Welcome to the November 2022 Green Screen. Today we'll be highlighting some of the exciting work found in this month's issue of the Green Journal. The editors have selected 3 articles to highlight. The first is titled, Live Birth Outcomes Among Women with Infertility and Anti-Mullerian Hormone Levels of 0.3 nanograms per milliliter or lower by Dr. Romansky et al. In this retrospective cohort study, the authors report that patients with anti-Mullerian hormone levels of 0.3 nanograms per milliliter or lower have fewer live births after their first initiated in vitro fertilization cycle compared to national outcomes. However, live birth rates do increase after cumulative treatments. The second editor's pick article is the Association of Physician Densities and Gynecologic Cancer Outcomes in the United States by Dr. Schmick et al. The authors note that increasing primary care physician density is associated with earlier stage at diagnosis and improved 5-year cancer survival rates for cervical cancer. The last editor's pick article is a prophylactic ureteral stent placement and urinary injury during hysterectomy for placenta accreta spectrum by Scaglione et al. The authors report prophylactic ureteral stents were associated with a decrease of nearly 80% in the odds of GU injury during hysterectomy for placenta accreta spectrum disorders. To hear more, listen to Dr. Jason Wright, Editor-in-Chief, on this month's installment of the podcast, which can be found on the Green Journal's website or where you download your favorite podcast. This month's editorial is by Drs. Ludgen and Werner, titled, More is Not Always Better, in response to the systematic review titled, One Step Compared with Two-Step Gestational Diabetes Screening and Pregnancy Outcomes, a systematic review and meta-analysis by Brady et al. In this study, the authors find that there is no difference in the rates for large for gestational age neonates with one-step testing strategy compared to a two-step testing strategy for gestational diabetes. Every month, the Green Journal selects articles and prepares structured questions to facilitate discussion during a journal club. This month's journal club article is the Association of Driving Distance to Maternity Hospitals and Maternal and Perinatal Outcomes by Minion et al. In this retrospective cohort study, longer driving distance to the delivery hospital was associated with a greater risk of perinatal outcomes in Pennsylvania. This article and the resources for the Journal Club can be found on the Green Journal's website. In this installment of the Clinical Expert Series, Drs. Baker and Crandon review long-acting reversible contraception. The authors provide a comprehensive literature review on long-acting contraceptives and discuss new evidence on the duration of their use, efficacy, and safety between different products. In addition to the articles that we've previously highlighted, you'll find the latest research on a variety of obstetrics and gynecology-focused topics. Here is a list of some of the other research areas that are included in this month's issue. Thank you for listening to this month's Green Screen. Be sure to visit the Green Journal website or pick up your copy of the issue to read the latest research and related articles promoting excellence in the clinical practice of obstetrics and gynecology.